Regenerative medicine is a term that you may be hearing more about these days, but you may not know exactly what it means. For the team at Buckeye Physical Medicine and Rehab, it's all part of their overall goals to have you living a pain-free, active, and healthy lifestyle. We have Dr. Roy Buzz Korth, the founder, joining me with more today. So good to see you again, Dr. Buzz.
How you doing?
First, what is regenerative medicine? Regenerative
medicine is the future of medicine, and that's a branch of medicine that actually helps the body heal itself. And that's achieved through several different things. That's, you can do it through hormones, you can do it through placental cells, PRP. These are all things we do at Buckeye.
So how long has this been here in the U.S.? Is this a new concept generally or not?
It's been in Europe for about 20 years and in the United States for about 10 years. And everything seems like it goes from the West Coast and moves to the East Coast. So it's been in California. Athletes have been using this for some time. If you look at, Tiger Woods, Peyton Manning, Alex Rodriguez, these people have been using this stuff, and that's why athletes heal so quick these days. But that same technology is available for us here today.
So what kinds of conditions would you treat? Would it just be somebody like an athlete? Is anybody that can benefit from it?
Well, we're all athletes, so we all have injuries. So it could be anything from, chronic knee pain, elbow pain, any injury you have that's not healing because you're getting older or because your body's not able to heal. Regenerative medicine is a solution.
Okay, so what is the basis behind it then? How does it help you, I guess, heal more? Is it just replacing, and you mentioned some platelets and things like that. What are you doing to the body?
One thing that's unique about Buckeye Physical Medicine and Rehab is we have the whole plethora of regenerative medicine. So there's a few different options. There's PRP, which is platelet-rich plasma, which we basically take a person's blood. We do that right there in the office, and we spin it down and get all the growth factors out of their blood, and we re-inject it into the injury site, and that helps the body heal it better.
Okay.
Another option we would have for somebody is we also use placental cell injections. And what placental cells is, these are donated by females. There's 8 centers around the United States where females can go and actually donate their placentas. These are tested very extensively the same way an organ donation would be and blood donation is. But the advantage of these placental cells is that each injection contains between 4 and 5 million live stem cells.
Wow.
And stem cells are the cells in your body that regenerate tissue. They can regrow bone, ligament, tendon, collateral vascular supply. So if you have, let's say, for example, a degenerative knee condition, if you don't do some type of regenerative medicine, eventually you're going to have knee replacement, which, 6 months of recovery, it's expensive. You can inject placental cells into that joint and actually regrow that cartilage without having a replacement. It's a miracle.
So is this something that a lot of people would do prior to going down the surgical route, right?
Most definitely, most definitely. Now, obviously, everyone's different, and that's what's so great about Buckeye is you can come to Buckeye, maybe a PRP procedure would be better. Maybe, we also use adipose or fat tissue and mix it with PRP and put it in the joints, or sometimes we use placental cell. We're the only center in Columbus. We have 5 locations that offers all of these modalities.
So if somebody thinks that they have like a chronic knee pain, how would they know if they're a candidate for this?
Step 1 would be come to Buckeye and let us evaluate you. Because obviously we're the ones doing the procedure. If you don't have an X-ray and MRI, that's what we would do first off to see the level of damage, and that would let us know what would be the best alternative.
Is there a lot of risk to these procedures since they are fairly new here in the U.S.?
No, they've done over 10,000 placental cell procedures and over 100,000 PRP procedures with absolutely no side effects.
So really, there's only benefits if they come in and find out that this is something that they should try out prior to having to go do surgery.
Correct, correct. It doesn't cost you anything to see if you are a candidate for it. So I strongly recommend, if you're listening to this, we know if you have a degenerative condition, like some type of degenerative joint disease, it's only going to get worse with time. And if you're taking cortisone shots or anti-inflammatories, that never stops that process. It might slow it down, but you're going on that path. And in particular, cortisone injections, which is pretty much the standard of care, every time a person gets a cortisone injection, they lose up to 8% bone mass.
Wow.
So that's why you're only allowed to get 3 per year. So if you're sitting listening to this and you're getting cortisone injections, it's not if, it's when you're going to have that joint replaced. Why not look for an alternative where you can actually regrow the tissue and heal the joint?
And at your practice, of course, the team approach is how you approach everything. And that's very important to healing, isn't it?
Correct, correct. At our facilities, we have medical providers who are specialists in regenerative medicine. We have physical therapists, and we have chiropractors and massage therapists. We work as a team there. So part of the healing process, if you put these, we'll say it's PRP or placental cells, is look at what biomechanically got you in that position and help you correct that so it doesn't come back.
And Dr. Buzz, people can always tune in to the radio you're on every week to hear more about all these things, right?
Yeah, we have a radio show on every Sunday on QFM and Sunday 95 at 7 a.m. So we bring patients on there talking about these procedures. It's an awesome show. So every Sunday at 7 a.m., QFM and Sunday 95.
All right, Dr. Buzz, you have plenty of locations around Central Ohio as well. You can check out the website, which is on the screen right now. Thank you.
Thank you.